Good idea.
I want the on-call surgeons to get to trauma faster and triaging could be stepped up. All of it was very good, but now we have to get to excellent.
I think some of the doctors are just plain dazzled by all the new equipment. Never seen so many professionals acting like kids at Christmas. Smartest thing they've done in a long time, naming you chief of trauma. Dr. Burke, are you all right?
I'm sorry, I just remembered something that I have to do in my office. Dr. Burke.
Vanessa!
Yo, number 2 in your class, little tip for you. If you call the head of trauma into the field, don't go calling her by her first name.
Thanks for the insight, but she's my sister. Yeah, the resemblance is startling, I know. Adopted.
Katie, talk to me.
Todd Marshall, 28-year-old male, pinned beneath truck. Legs crushed, bleeding internally. Too heavy for airbags. Car's backed up for miles, heavy tow, can't get through the tunnel to lift the truck off of him. It'll take too long to come around to the other side.
Todd, I'm Dr. Burke. Todd, you're bleeding internally. If we don't get you up from under this truck in a matter of minutes, you could die. We're gonna have to remove your legs in order to do that. I'm sorry.
No.
Todd.
No.
Did you hear what I said?
No.
Look, I know that you're scared, but we don't have a lot of time here.
I don't care. Do you hear me? Do not cut off my legs. Do you hear me? I'd rather die. Do not cut off my legs.
You're not gonna leave him there.
I don't know what I'm gonna do, Katie.
He'll die, Vanessa!
I can't just do what you think is right. I can't just do what I think is right. I cannot operate on a man when he is expressly stating that he doesn't want me to. By law, that's assault.
It's not you that's assaulting him, for God's sakes. It's the damn truck.
He's lost consciousness. He's unresponsive.
He's not expressing anything anymore.
Okay, we got like minutes.
Double amputee in the field. Let's get him to the trauma OR now.
Your team's standing by. 2 lines, no waiting.
Nice field amputation, Dr. Burke.
That isn't an oxymoron.
One of your med students just fainted.
Rookie squeamishness, he'll learn. That's no rookie, that's Bonnie. She's been the charge nurse here for 15 years. Can you take over here?
Sure.
Matt, what happened?
I don't know. She was resuscitating him, now we're resuscitating her.
Who was Kevin treating? Kevin, the med student. Who was he treating before he fainted?
That same guy.
Mouth filled with fluid. He's sweating profusely. Have you been urinating a lot since the accident?
I was just in a friggin' car wreck. I was scared.
Let's not fear. It's poison. There must have been a chemical spill at the accident. All these people have been contaminated. Dr. Burke.
Vanessa, have we identified the exact poison? What is the danger level?
Katie, it's poison. That's why there's that skull and crossbones on the packaging. It's life-threatening.
Victim seizing.
Katie. Katie, get out of there. Katie!
You're enjoying this, aren't you?
I should have you and Zach suspended.
Commended? That's nice. Is it gonna be a certificate?
You
or-
heard what I said, smartass. I gave you a direct order and you ignored me.
There's a man in a truck seizing. I wasn't gonna just leave him like that.
I know you want to do well at this job, and you are, but you don't have to be a superhero out there.
Would only one Wonder Woman per family? Is that the deal?
Go find some scrubs. Dinner's at 7:30.
So I go talk to the little girl, and she tells me that her mother passed out cold at some diner. The girl, Cynthia, knows that mommy better get home, get showered, get sober, and get to work. So she decides to drive her.
Oh, God.
I think I gotta call the cops on this one.
Right. Your close personal friends, the cops?
Very funny.
Katie, you've been in the medical profession, what, 18 months? I've been in it for years. There are rules, there are protocols for doctor-patient confidentiality. Pass me that red pepper.
What if I tell you I already called them?
You didn't.
How do you know?
Because from the time you were a kid, whenever you'd start a sentence with, what if I tell you, I knew you were full of it.
Look, I know all about your rules. Paramedics have the same ones, you know, and the exception to the rule is child abuse.
This isn't child abuse. Neglect, yes. Stupid? Hell yes. But for the record, I think I have a damn good understanding of what qualifies as child abuse.
How am I supposed to argue with you when you play that card?
It isn't a card. It was my life.
Ladies, any chance we can table this until after dinner?
No.
Mi amor,
Esta me tiene loca.
tranquila, okay?
I don't know what that means, but you're wrong. Just because something isn't as bad as what happened to you doesn't mean it's not bad.
I didn't get you into this program so that you could lose your license for violating privacy rights.
Oh my God, you and your rules. Oh, first we can't amputate because the guy says no. Okay, let him lay there and bleed to death.
We didn't, did we?
And now here's this little girl with this crappy life and you're telling me to ignore it. You know, if mom had your attitude, you would have stayed growing up in a home for unwanted children, not coming to live with us.
Right. And then your life would have been perfect. And you would have never run off with that scumbag loser George and become a liar and a thief.
He's been out of my life for years. Could you stop bringing him up every time I turn around? You'd think you were in love with him.
No, I'm smarter than that.
Screw you.
There's no indication of any residual effects of the contamination. You're clean.
Maybe it's a good thing I got thrown from the car. I got away from the poison.
I have to say, that is the most positive spin I've ever heard on being ejected at high speed.
Hi, Dr. Campbell. Dr. Burke was just giving me the good news.
Doctor. Debbie, something turned up on your CAT scan. You've got an intracranial aneurysm.
From the accident?
No. You may have been asymptomatic, but it looks like you've had this for several years.
Is it serious?
If it's not removed, it's potentially fatal, yes. Is there anyone that we could call for you?
I'm Dr. Burke. I operated on you. Can I talk to you for a few minutes? Todd, I know this must be extremely difficult.
I told you. I didn't want this. You did it anyway. I could sue you.
I'd rather be sued for saving your life than for letting you die. Is there anything that I can do to help you? Anything I can bring you? Maybe you should get some rest.
I saw this thing on TV. They're showing this rehab place for vets. It had this steep driveway that went straight to the interstate. Guys would take their wheelchairs and roll right out into oncoming traffic. Good night, Doctor.
Hello?
This is Squad 5. May I speak with a trauma specialist, please?
Katie, this isn't the hospital. You dialed my house.
Yes, we have a young woman, possible overdose, unobtainable vitals. We've been performing CPR for approximately a half an hour.
Oh, you haven't taken her to Rittenhouse yet?
No, doctor, we haven't tried that.
Katie, what's going on? If this is a joke, it isn't funny.
We should give her another shot of naloxone. You got that, Zach?
Yeah.
Push 2 milligrams.
Katie, are you all right?
What if I tell you who I am?
Katie!
Code 4! Code 4!
Oh, thank God. Are you okay?
So this is what they mean by baptism by fire? Because I'm...
Come here.
Being close to mine, pounding up against the stone and steel.
Thanks.
Walls that I
Anytime.
Sometimes the hurt is so
Hey, Doc. You're the one who pulls some strings to get your little sister on the squad, right?
Yeah, that's right.
Sometimes all I can do is
Nice going.
weep with all this rain falling down.
He said he'd kill us if we didn't save his girlfriend. Except when we got here, she was already OD'd. I just spent the last 40 minutes doing CPR on a corpse.
Is this one of the contamination victims?
Frank, the man driving the truck carrying the pesticides. He got the worst of it. Respiratory failure. He was drowning in his own secretions. Had to do an emergency cric on him. But his prognosis is good.
That's no easy feat. Saving someone with acute organophosphate poisoning? Matter of fact, every person that was in here after that accident owes you their life.
That's what I'm here for.
Doctor, I'd like to ask you something, but I don't want to put you on the spot, so feel free to tell me it's none of my business. Could we, Sure. The other day when we were talking in the hallway before all the commotion started, something happened. If you want to talk, it'll stay between us.
Look, this has never kept me from treating a patient or in any way harm my performance as a physician.
How long have you been having panic attacks?
Let's just say I had a bad childhood. There was abuse, and it's got its residual effects. I do biofeedback once in a while, and there are breathing techniques that I use. The thing that pulls me out of it, though, right away, and somebody's worse off than I am. If they're hurt or scared or in trouble, it gets me right out of my own head. That's why I picked trauma as a specialty. Somebody always...
Usually it's a couple days